This presentation will define and talk about critical thinking and tools for critical thinking, and then finally how those apply to you as a future dental hygienist. So first, to get started, let's put a definition to critical thinking. There's a couple of different ways that we can define that. One is to expand thinking in a thorough and systematic process to consider all aspects of a problem. Another way to define critical thinking would be to say it's the identification and evaluation of evidence to guide decision making. There's a process that we'll follow when trying to use critical thinking. First in that process will be to collect the information, evaluate the information, then we'll use logic to draw conclusions, and then use a logical approach to evaluate our conclusion and see if it's going to work. Here are some tools that you would use to collect information, the first step of critical thinking. Asking questions, collecting data, using the who, what, where, and when you're asking questions, and also you're going to use secondary questioning. That will help give you a more precise, accurate, and clear detail to the information that you're trying to collect. Some examples of an actual tool you might use would be a survey, face-to-face interview, or any kind of assessment. Next, we'll talk about tools for evaluating the information. When you're going to again use a set of questions and look for these characteristics of the information that you've collected. The information should be relevant to the problem that you're trying to solve. It should also be significant, as well as crucial, and it should be applicable. So think of this step as weeding out anything that just isn't important and trying to get down to the good stuff. All the characteristics that's going to help you solve your problem. And next we'll look at the tools that we would use to draw a logical conclusion. This step's going to involve using, again, logic. This helps us avoid errors, having errors in our conclusion. So you're going to look for these characteristics in the information. You want to know if the information is valid, is it credible? Can you basically prove that? We also want consistency in your information. And this is the step where you're really going to look at the information. You've narrowed it down to things that are relevant and applicable. Now you're going to look at it and just really overall see if it makes sense. If there's something that just doesn't make sense, you're going to recheck that info for consistency. And then finally we're going to talk about evaluating the conclusion. And these questions will help you evaluate your conclusion. So this is going to be where you find the answer to your problem. And then you're going to find out if this is a good answer by asking, is it reasonable? And has all the information been considered? Is there any additional information that we need to gather? And then you're also going to want to see in your conclusion if the original problem has been addressed. And also make sure to include that all points have been considered, all viewpoints have been considered. When you feel confident that you can answer yes to these questions, then you have a viable solution. Next we're going to look at these critical thinking steps and tools that we've already gone over, and we're going to see how this applies to dental hygienists. So in the clinical setting, the dental hygienist uses evidence-based practice and decision-making to provide optimal oral health care to the patient. That means we have to think critically. And what this really means for evidence-based practice is we're going to collect information. And we do this through collecting medical and dental histories, radiographs, periodontal evaluations, etc. This is where when we assess the patient, we're taking in all the information that we need to address their problem, address the complaint they might have, and come up with a solution. It's important to remember that sometimes through data gathering, we're going to uncover other problems that the patient may not even be aware of. Your patient might come in and have a complaint, such as they would like their teeth to be whiter, and they're concerned about how their teeth look, but there could be other problems that they're unaware of. So data gathering is going to help you address their concerns as well as uncover any other problems. After you've gathered all the data, then you're going to come up with the dental hygiene diagnosis. And this is a pretty complex process, but basically this is where you're using all the information to evaluate what's important, find out what things they're doing or aren't doing that is leading to the problems that they're having in their oral health care. And then once you evaluate and you look at all that information, you're going to implement. First you're going to come up with the dental hygiene care plan, then you're going to help the patient implement it. And that's going to consider all aspects of their needs, whether it relates to a complex medical history or whether it's as simple as they just really need to brush, twice a day instead of just once or twice a week. So there's going to be varying degrees of how complex this is and how many pieces of the puzzle that it really encompasses. And this is how dental hygienists will use critical thinking in day-to-day practice. And you'll repeat it every day over and over with every patient. You're going to gather, analyze, and answer.